Antisocial personality disorder is an chronic mental health condition. Look at this picture shows that antisocial behavior, brain images, MRI to analyze brain involvement in antisocial personality disorder. Look at these pictures. A detail going on. Introduction. Antisocial personality disorder is a chronic mental health condition characterized by a persistent pattern of disregard for the rights of others. Individuals with ASPD often engage in manipulative, deceitful, and impulsive behaviors without feeling guilt or remorse. This disorder typically begins in childhood or early adolescence and continues into adulthood. It is a serious condition that can lead to legal, financial, and interpersonal problems. Definition. Antisocial personality disorder is a mental health condition characterized by a pervasive pattern of disregard for and violation of the rights of others. Individuals with ASPD often show a lack of empathy and remorse, along with behaviors such as deceitfulness, impulsivity, and irresponsibility. Diagnostic and Statistical Manual of Mental Disorder DSM-5 says antisocial personality disorder is a pervasive pattern of disregard for and violation of the rights of others, occurring since age 15 years, as indicated by at least three of following. 1. Failure to conform to social norms concerning lawful behaviors. 2. Deceitfulness. 3. Impulsivity. 4. Irritability and aggressiveness. 5. Reckless disregard for the safety of self or others. 6. Consistent responsibility. 7. Lack of remorse. Etymology. The term antisocial personality disorder originates from the Greek anti against and Latin societies, companion or society, indicating behavior that goes against societal norms. The purse emerged in psychiatry in the mid 20th century, evolving from earlier terms like psychopathy and sociopathy to describe chronic disregard for the rights of others. types. There are no official subtypes of ASPD, but individuals with the disorder can present in different ways, such as 1. Aggressive type, characterized by violent and hostile behavior. 2. Deceitfulness, marked by chronic lying and manipulation. 3. Impulsive type, involves reckless and responsible decision making. 4. Curious and emotional type, demonstrates a lack of empathy and remorse. Causes of ASPD. Several factors contribute to its development, including 1. Genetics, family history of personality disorders or mental health issues. 2. Brain abnormalities, differences in brain structure and function, particularly in areas responsible for impulse control and emotion regulation. 3. Environmental factors, childhood trauma, neglect, or exposure to violence. 4. Substance abuse may contribute to the worsening of symptoms. 5. Parental influence, having a parent with antisocial behaviors can increase risk. Risk factors. Several risk factors increase the likelihood of developing ASPD. 1. Male gender, more common in men than women. 2. Early childhood, conduct disorder. 3. Unstable or abusive family environment. 4. Low socioeconomic status. 5. Substance abuse history. 6. Neurological damage. Complications. ASPD can lead to serious complications include 1. Legal problems, criminal activities. 2. Substance abuse disorders. 3. Relationship difficulties. 4. Employment instability. 5. Increased risk of violent behavior. 6. Premature death due to risky behavior. Pathophysiology. Dysfunction in the prefrontal cortex and amygdala leads to poor impulsive control and lack of empathy. Abnormal levels of serotonin and dopamine contribute to aggressive and impulsive behaviors. Reduced autonomic nervous system response to stress may cause a lack of fear. The pathophysiology of antisocial personality disorder involves a combination of genetic, neurobiological, and environmental factors that contribute to persistent antisocial behaviors. Here is a step by step breakdown. 1. Genetic and epigenetic factors. ASPD has strong hereditary component with genetic influences accounting for around 50% of the risk. epigenetic modifications, example DNA, may alter gene expression due to environmental stresses like childhood trauma. 2. Brain structure and function abnormalities. Prefrontal cortex dysfunction, reduced volume and activity with prefrontal cortex, which regulates impulsive control, decision making, and social behavior. Amygdala dysfunction. The amygdala, responsible for processing emotion like fear and empathy, is often smaller or less active, leading to reduced emotional responsiveness. 3. Neurotransmitter dysregulation. Serotonin deficiency, low serotonin levels, and linked to impulsivity and aggression. Dopamine dysregulation, increased dopamine activity may contribute to reward seeking and risk taking behaviors. Cortisol and stress response abnormalities. A blunted cortisol response reduces fear and stress sensitivity, making individuals less likely to learn from negative experiences. 4. Early childhood trauma and environmental influences. Neglect, abuse, inconsistent discipline can impair emotional regulation and social bonding. Exposure to antisocial role models or unstable environments can reinforce maladaptive behaviors. 5. A behavioral manifestation and chronic pattern. Persistent disregard for social norms, deceitfulness, aggression, and lack of remorse, difficulty forming stable relationships, and increased risk of criminal behavior, substance abuse, and legal issues. This stepwise pathophysiology highlights how biological vulnerability interact with environmental factors to shape ASPD behaviors. Signs and symptoms. 1. Repeated criminal acts. 2. Deception and lying. 3. Aggressive behavior including physical assaults. 4. Lack of remorse for actions. 5. Impulsivity and reckless disregard for safety. 6. Failure to sustain long-term relationship. 7. Manipulation of others for personal gain. Diagnosis. The diagnosis is based on one clinical assessment using DSM-5 criteria. 2. History of conduct disorder before age 15. 3. Psychological evaluation. 4. Interview with family members. 5. Ruling out other mental disorders. Nursing diagnosis. 1. Risk for violence towards others related to impulsivity. 2. Impaired social interaction related to manipulative behavior. 3. Ineffective coping related to designed for societal norms. 4. Chronic low self-esteem related to history of childhood neglect. 5. Non-compliance with treatment regime related to lack of insight. Medical management. 1. Medications, antipsychotics, mood stabilizers, antidepressants. 2. Behavioral therapy. 3. Substance abuse treatment if necessary. Nursing management. 1. Set clear boundaries and limits. 2. Encourage participation in therapy. 3. Monitor for aggressive behaviors. 4. Educate on consequences of actions. 5. Develop coping strategies. Treatment options. First option, cognitive behavioral therapy (CBT) helps modify harmful thought patterns. 2. Dialectical behavioral therapy improves emotional regulation. 3. Medication. No specific cure but helps manage aggression and impulsivity. 4. Group therapy provides peer support and accountability. 5. Anger management programs helps control aggressive tendencies. Psychosocial medicine. 1. Family therapy educates family members on how to cope. 2. Social skill training teach appropriate social behaviors. 3. Vocational rehabilitation helps individuals develop job related skills. 4. Community support program offers resources for reintegration. 5. Substance abuse treatment addresses co-occurring addiction issues. Prevention. 1. Early intervention in childhood treating conduct disorder. 2. Positive parental involvement. 3. Education and awareness programs for reducing exposure to violence. 5. School-based behavior modification program. In conclusion, antisocial personality disorder is a severe mental health condition that significantly affects individuals and society. While there is no cure, early intervention, therapy, and a strong support system can help manage symptoms and reduce harmful behaviors. Raising awareness and providing adequate mental health resources are crucial steps in preventing and managing ASPD effectively. Thank you. Have a nice day.